Affordable Care Act, the name of the health care reform we passed 2 years ago. In doing so, they've reaffirmed a fundamental principle that here in America, in the wealthiest nation on earth, no illness or accident should lead to any family's financial ruin. I know there will be a lot of discussion today about the politics of all this, about who won and who lost. That's how these things tend to be viewed here in Washington. But that discussion completely misses the point. Whatever the politics, today's decision was a victory for people all over this country whose lives will be more secure because of this law and the Supreme Court's decision to uphold it. And because this law has a direct impact on so many Americans, I want to take this opportunity to talk about exactly what it means for you. First, if you're one of the more than 250 million Americans who already have health insurance, you will keep your health insurance. This law will only make it more secure and more affordable. Insurance companies can no longer impose lifetime limits on the amount of care you receive. They can no longer discriminate against children with pre-existing conditions. They can no longer drop your coverage if you get sick. They can no longer jack up your premiums without reason. They are required to provide free preventive care like checkups and mammograms, a provision that's already helped 54 million Americans with private insurance. And by this August, nearly 13 million of you will receive a rebate from your insurance company because it spent too much on things like administrative costs and CEO bonuses and not enough on your health care. There's more. Because of the Affordable Care Act, young adults under the age of 26 are able to stay on their parents' health care plans, a provision that's already helped 6 million young Americans. And because of the Affordable Care Act, seniors receive a discount on their prescription drugs, a discount that's already saved more than 5 million seniors on Medicare about $600 each. All of this is happening because of the Affordable Care Act. These provisions provide common sense protections for middle-class families, and they enjoy broad popular support. And thanks to today's decision, all of these benefits and protections will continue for Americans who already have health insurance. Now, if you're one of the 30 million Americans who don't yet have health insurance, starting in 2014, this law will offer you an array of quality, affordable private health insurance plans to choose from. Each state will take the lead in designing their own menu of options. And if states can come up with even better ways of covering more people at the same quality and cost, this law allows them to do that too. And I've asked Congress to help speed up that process and give states this flexibility in year one. Once states set up these health insurance marketplaces, known as exchanges, insurance companies will no longer be able to discriminate against any American with a pre-existing health condition. They won't be able to charge you more just because you're a woman. They won't be able to bill you into bankruptcy. If you're sick, you'll finally have the same chance to get quality, affordable health care as everyone else.
The United States, one of the wealthiest countries in the world, has the most unaffordable health care system for its people, while neighboring countries like Canada and Cuba have universal coverage for anyone who comes walking through their doors.
Obamacare is trying to change this.
My opinion of Obamacare, first of all, I call it Obama Cares, okay? Every civilized country, every developed country in the world has a health care plan for its citizens. This is just, to me, it's just common sense. The fact that there's any argument about it at all is, I think, silly. You have to take care of people. Part of being a citizen is to take care of other people, and we should all have affordable health care. Now, there are ways to keep the cost down other than not have it. One is to limit unnecessary procedures, and I also think we could save a lot of money in this country, a huge amount of money, if we didn't rely to such a great degree on drugs, on pharmaceuticals, that doctors were prescribing expensive drugs as if they were candy.
The Affordable Health Care for America Act was a bill that was crafted by the United States House of Representatives in 2009. It is a reform of the United States health care system that ultimately creates a universal health care. It has many key provisions that include prohibiting health insurers from charging different rates based on patients' medical history or gender. It requires most employees to provide coverage for their workers or pay a surtax on the worker's wage up to 8%. It is an expansion of Medicaid to include more low-income Americans by increasing Medicaid eligibility limits to 133% of the federal poverty level, and by covering adults without dependents as long as either or any segment doesn't fall under the narrow expectations outlined by various clauses throughout the proposal. It is a central health insurance exchange where the public can compare policies and rates. It allows insurers to continue to dictate limits on evaluation and care provided by their physicians.
I believe that the Affordable Care Act promoted by the Obama administration was a bold and aggressive attempt to get this country to focus on the unfortunate realities that is the rising cost in healthcare. I don't know whether it's a perfect system because the system, provisions of the system, major features of the system have yet to be implemented and rolled out, but I believe that it's the start. And like I said, it's generated national discussion, and like any plan, there's a need for a comprehensive reevaluation. But at the end of the day, Americans struggle with the rising cost of health insurance, and I think that this was an attempt to control just that.
There are many pros and cons to the Affordable Care Act, otherwise known as Obamacare. Obamacare regulates annual maximums and by 2014 will eliminate lifetime maximums for essential benefits such as hospital stays, guaranteeing that you won't spend years paying for health insurance premiums only to run out of coverage and get stuck with enormous medical bills if you have an accident or if you develop cancer or other devastating medical conditions. Obamacare also prevents insurance companies from using technicalities to drop coverage for people who develop expensive medical conditions, essentially leaving them stuck with medical care costs they believe would be covered. Obamacare provides tax credits to small businesses to encourage them to keep providing health insurance to employees. Obamacare also regulates insurance companies and prevents them from implementing large, unjustified rate hikes. Like anything, Obamacare has many cons. Mitt Romney is arguably the biggest critic of Obamacare, and here he is speaking of the repercussions that we face due to the new healthcare system.
As you might imagine, I disagree with the Supreme Court's decision, and I agree with the dissent. What the court did not do on its last day in session, I will do on my first day if elected President of the United States. And that is, I will act to repeal Obamacare. Let's make clear that we understand what the court did and did not do. What the court did today was say that Obamacare does not violate the Constitution. What they did not do was say that Obamacare is good law or that it's good policy. Obamacare was bad policy yesterday, it's bad policy today. Obamacare was bad law yesterday, it's bad law today. Let me tell you why I say that. Obamacare raises taxes on the American people by approximately $500 billion. Obamacare cuts Medicare by approximately $500 billion. And even with those cuts and tax increases, Obamacare adds trillions to our deficits and to our national debt and pushes those obligations on to coming generations. Obamacare also means that for up to 20 million Americans, they will lose the insurance they currently have, the insurance that they like and they want to keep. Obamacare is a job killer. Businesses across the country have been asked what the impact is of Obamacare. 3/4 of those surveyed by the Chamber of Commerce said Obamacare makes it less likely for them to hire people. And perhaps most troubling of all, Obamacare puts the federal government between you and your doctor.
When learning about Obamacare, it's important to understand how this will affect you. You will now be able to stay covered under your parents' medical insurance up until the age of 26, opposed to only staying on their insurance unless you had an occupation that offered you medical insurance. Under Obamacare, women still have the choice on whether or not they would like to receive an abortion. Less money will be spent on education due to the increase in costs that Obamacare healthcare will place on America. Premium rates are going to skyrocket for the young Americans paying for their healthcare, while older Americans will pay low premiums for their healthcare. Americans are going to face a loss of coverage because Obamacare puts in place new rules that prohibit plans with annual limits. As you can see, Obamacare has its pros and cons. In 2014, when the healthcare system is set into place completely, Americans' lives are going to be very different when it comes to their healthcare. Taxes are set to increase and coverage plans are set to change, but Obamacare is the future of American healthcare.